Good evening, everyone, and welcome to the webinar. My name is Carson Carpenter. I'm the president of Compliance Training Partners. I'll be your presenter tonight. And my presentation is going to be on top OSHA and infection control violations of 2023 and 2024. And really what this is all about is that Compliance Training Partners, we deal exclusively with this. So we get a lot of referrals from people who've been inspected, who've had problems. And I'd just like to share with everybody tonight what the common violations are, how you can protect yourself. And you know, it's not really that hard to do this, to come into compliance. And that's going to be the whole point of this webinar, illustrating to you where things go wrong, how you can prevent it. And the number one of the things we see, certainly the top or right up there, is not having a written hazard communication plan. You know, a lot of times we'll ask people, hey, are you in compliance with the hazard communication standard? And they will say yes, thinking that because they have a few labels and safety data sheets, they're in compliance. But you actually need to have a written hazard communication plan. And let me show you a little bit of just what hazard communication says you have to do. You have to have this written plan that talks about how do employees get to safety data sheets in your office? What type of labeling program do you use? What type of personal protective equipment do you have available? And if that new employee comes in, how do they get training? Because training is one of the main requirements. So a written hazard communication plan. Now, hazard communication, this is the regulation. They often call it a right to know law. The reason they do that is that this is the law that says, look, we're all working with chemicals. You have the right to know what you're working with and how to protect yourself. That's really all this regulation states. By the way, we do have a Q&A button here. And I'm going to take questions at the end, but also along the way, if a particular slide prompts a question, hit me with the question on the Q&A button. I'll get to as many of them as I can. The other thing I want to let you know too is that you will have a way of contacting our technical services people. If we can't answer all the questions or you come up with a question that maybe you didn't think of tonight, you think of it next week, we'll be glad to answer it at any time. So first thing, if you want to avoid this problem, you want to put somebody in charge of hazard communication. I would pick a trusted clinical person, so a trusted hygienist, a trusted assistant, because they need to be a back office person, because you need to have a hazardous chemical inventory. You need to make sure you have safety data sheets for your chemicals. You need to make sure the chemical containers are labeled. You need to have, again, a training program for all the employees, something that can be used when you onboard that new employee. And again, you need to have that written hazard communication plan. So important to have that written plan. One of the first things that's looked for in a common violation that we see. I mentioned the chemical inventory list. Let me tell you an easy way to do this. It sounds like a lot of work, right? A list of everything in your facility. But what I would do is contact your supplier or do a query on their website of what you've purchased for them over the last 18 months. Pretty easy then to get that list. And now you can put it into Excel form or a Word document. And now it's a very easy thing every year just to update it, maybe add or delete a few products. And what you want to do is put a copy of this chemical inventory list in your compliance manual and also post it in a prominent place. So a kitchen, a break room, near the time clock, someplace where everybody can see it. Now, labeling, you might think this is really going to be difficult, but it's not, because you only need to label things that aren't in their original container. Basically, anything you buy from a reputable supplier is going to have a manufacturer's label on that's going to comply with the requirements under GHS, the globally harmonized system. But what if you do something like this person did? You took, in this case, they probably had a very large container of isopropyl alcohol. They put it into an unlabeled container. Now you need to put a label like this on it. And there aren't that many places in the office I see you need to do this, but think about this, I'll describe another common scenario, and then you can stop and think where you might have this in your office. We all buy an ultrasonic enzymatic solution, right? Comes from our dental supplier. It's got a label on. That's great. But now we pour it out of the bottle into the ultrasonic. Now that's an unlabeled chemical. So you want to put a label like this on that ultrasonic or on the wall right behind it. And what's hazardous, or what's considered a hazardous chemical in dentistry? Pretty much in your office, any powder, liquid, or paste. So we're talking about our restoratives or disinfectants or cleaners, even things like plaster, stone, alginate. The dust there is considered a respiratory hazard. That being said, I want you to all know dentistry is a very safe place to be. We have chemicals in our kitchen, in our bathroom, in our basement, in our barn, in our garage. It's just that in the workplace, we have these OSHA requirements to make it even safer. What a label should look like is this. This is what's called, again, a globally harmonized system compatible label. It identifies the hazardous chemical. It has the manufacturer's contact information. Also, it's going to have a signal word on it. And look for these signal words. It's either going to be danger or warning. Danger means really be careful. For example, it might say danger contains formaldehyde. Where warning, still a hazard, but not so much. It might say warning contains isopropyl alcohol. You'll also have on these labels these pictograms. There's 9 different pictograms. And I think you'd agree they're pretty intuitive. This looks like a flame. Sure enough, it's flammable, but there are 8 other pictograms. I really like to have some type of wall chart up that shows the team what these pictograms mean. So I always say, have a written program or buy a written program, write a written program, but have a written program. That's the most common violation we see. Now also in the area of hazard communication, in fact, we were just involved in an inspection in the state of New York just 2 weeks ago. And this was one of the violations under hazard communication. They didn't have safety data sheets. If they're missing, if they're poorly organized, maybe you have the old MSDS sheets, which are obsolete now, but a safety data sheet is basically the chemical Bible on the products you use. It's detailed. It has 16 sections that go over anything from chemical content to first aid measures. So have these safety data sheets. And here was the problem that this office had. They thought they had safety data sheets because their response to where your safety data sheets was, we go to the web, we Google up the name of the product, we try to find the SDS, and that's what we do in an emergency. That won't fly. We need to have it either in a binder like this, in an organized manner, so in alphabetical order, or download it onto a laptop. Okay, have a dedicated laptop. Bring in an old laptop that you don't use for anything else. Don't have it password protected. Have it really easy to get into. It doesn't even have to be connected to the internet if you don't want, but have your SDS sheets either in a binder or on a hard drive in your office that everybody can get to. And this also helps fulfill this requirement of needing to maintain these safety data sheets for 30 years. This is one of the longest record-keeping requirements there is. Again, if you know you need to do this and you assign somebody to do it, it's not that hard. And once you have it, things don't change often in dentistry. A couple new products 1 year, a couple new products the next year. It's pretty easy. So have these safety data sheets available, something they always look for. Another violation that was right up there at the top was not having an eye wash, or even more common, people had an eye wash, thought they had an eye wash, but it wasn't functioning, or it wasn't an approved eye wash. And here's how this happened. First of all, you've got to have an eye wash that's like this. It's got to be binocular, so it gets both eyes at once. And the actual reg is that it's got to deliver basically half a gallon of water a minute for at least 15 minutes. So if you have these squeeze bottles that say eye wash on, I see them in offices all the time, that absolutely won't fly. It should be illegal for them to make plastic bottles and write eyewash on, because they definitely that's an OSHA violation. Also, they say must be within 55 feet of any chemical hazard. Well, unless you have an extremely big office, you only need one eyewash. I mean, unless you had an office that was over 110 foot long, then you'd need a second one. So have an eyewash like this, and it says too, must be inspected and activated weekly. We have run into a number of clients who got into trouble because they had this eyewash. They hadn't turned it on maybe in years. What you need to do, it's simple. It takes 30 seconds. Assign somebody to do this. Whoever's in charge of OSHA walks up to the eyewash, turns on the water, pulls the button. These green caps fly off, let it run 20 seconds, done. But document it. It's an unknown requirement that an eyewash be inspected and activated weekly. Simple stuff, right? This isn't tricky stuff, but a lot of times we're so busy practicing and trying to run the office, we just don't think about this. Now, another thing that might surprise you is a top violation is not offering exposed employees the hepatitis B vaccine, or not having a signed declination form for those who don't want this vaccine. Now, the way I see this violation occur, almost everybody today has had hepatitis B immunization. In fact, it's approved for anybody over a year old. So unless you're talking about much older employees, everybody's offered it as a child, or everybody had it at their previous job. The problem becomes they don't have proof of it in their employee medical file, or they haven't signed a declination form saying, I don't want it. And you can easily say, look, I know this is a new job. I know you've offered me the hepatitis B immunization, but I don't want it because I had it about 6 years ago, so I just don't want it again. Well, get that declination form signed. And the reason OSHA takes it seriously is, of course, hepatitis B. It can cause severe liver damage, death. It can survive outside the body for a week. So it can live on our dental unit for a week at room temperature. It's very transmissible. It's transmitted from sexual contact, contaminated needles. Thought you'd find it interesting. It can even be transmitted from mother to child during pregnancy or birth. But immunization is highly successful, maybe one of the best vaccines ever created in terms of immunologic memory. For most people, it's once in a lifetime, and they maintain adequate titers of against hepatitis B. So again, if that employee doesn't want to get immunized, that's fine. They need to either give you proof of immunization or sign the declination form. So again, this is why we need to have somebody in charge of OSHA, a trusted clinical person who can check the boxes on these new employees. By the way, one thing we will give you access to at the end of this presentation is an audit app. So you'll actually be able to go in and audit your app or audit your office and see where you're in compliance and where you're not. So don't worry if you're not getting all this written down. Also, this presentation will be recorded. Now, I'm not going to read this to you, but basically a declination does need to have this exact wording. It needs to say, look, I've been offered the vaccine. I know it's a dread disease. I understand I'm putting myself at risk if I don't get it, but I've declined to get it. And if I ever decide to change my mind, I want to get it in the future, it'll be provided to me at no charge. So make sure you have this. Now, here's one that I see often. In fact, when we do webinars at Compliance Training Partners, we do a lot of webinar training across the US. Although I'm trained as a dentist and most of our staff has a dental background, we provide OSHA compliance training for medical offices. Actually, we even do a lot in the veterinary medicine area. But people don't realize that they need a baseline TB test for all employees. In fact, when I've done polls on webinars, it will show typically only 15% of people doing this. mainly because they just don't know that they need to do it. So let's just talk a little bit about TB and why. TB, again, the reason for the concern by OSHA is it's an airborne disease, not a bloodborne disease. So it's spread much like COVID, right? From laughing and speaking, coughing and sneezing, which of course are things we can be exposed to in a dental office. It's important to know the two types of TB conditions because there's a big difference. For example, between latent TB or TB disease. In latent TB, this patient's infected, but these bacteria are not actively reproducing. So this patient is non-infectious. They don't display symptoms. Also, you could insert the word employee. If an employee has TB, they're non-infectious and they typically display no symptoms. So they could be treated in the dental office, they could work in the dental office, that's no problem. Or if they have TB disease, these bacteria are actively reproducing, they're quite infectious. They're typically symptomatic with, productive cough and a number of symptoms associated with respiratory disease. You can't have these people in your office. So it's really important to understand TB. Now, the most common symptoms, again, fatigue, fever, weight loss, night sweats, again, a chronic and productive cough. So coughing up blood, coughing up mucus. Fortunately, in a dental office, we are considered a low-risk facility. That means that we're unlikely to be seeing TB patients. I think that we're probably safer than ever from TB. One of the few things we can thank COVID for. I think that most healthcare offices, particularly dental offices, we do an even more careful and thorough respiratory disease screening before patients come in. And I think we're a lot less likely to treat patients today that have any type of respiratory disease symptoms. Basically, in a low-risk facility, which you are, everybody I'm talking about here is, you just need to get it one time, a baseline test. I would try to form a relationship with a local occupational medicine clinic. I would Google up occupational medicine clinic. Let's say you live in Tulsa, Oklahoma. Give them a call. Let them know you're a local dental office. You want to have a place that you can send people for TB baseline tests, which, by the way, should only be about $30, $35 a person. Someplace you can send your employees for hepatitis B immunization. Someplace you can send employees if there's an accident, like a needle stick in the office. So form that relationship. Now, just so you know, if we worked, say, in a hospital, a medium risk facility where we're likely to see TB patients, we need to not only get that baseline test, we would need to get an annual test. A couple of good questions here. Janet asked, and Janet, I think I probably answered this one. I think you answered or asked this question just before this slide, but yes, the employer does pay. It's the responsibility of the employer. And again, I highly recommend occupational medicine clinics for a number of reasons. One, they have long hours. They're very available. If you have an accident in the office, they know how to bill workers' comp insurance. They're usually quite familiar with post-exposure treatment too. So that's what I would do. And someone asked here, Karen asked, she says, I got a hepatitis B vaccine 20 years ago. Do I need to get another? I would say the odds are very high. If you seroconverted back then, and you probably did, the odds are extremely high you're still protected. What I would do is the next time you have a physical and they're drawing blood, why don't you say to them, Karen, just say, can you run a hepatitis B antibody titer for me? And the number you're looking for is 10 milli-international units. If you're at 10 or higher, you're considered protected. If you're lower, you may want to consider a booster. Odds are extremely high. You're protected though. Good questions. So a TB patient, a potential TB patient, we need to defer treatment on those people because you can't treat them safely in your office. If you suspect it, get a mask on them, move them away from others. And of course, in your office, always have, especially as we come here into the cold and flu season, alcohol hand rubs, tissue available, no-touch receptacles, Again, these are people we can't treat in our office safely. Even when we're wearing masks, gloves, glasses, we can't treat them unless we're wearing N95s and have negative air pressure rooms, UV irradiation of the air, all things that we don't have. Another really common violation, one of the top 10 that we see, is not providing required employee training. And again, training needs to be done annually in the dental office, but training also needs to be done as part of the onboarding process. I would highly recommend that you consider purchasing some online training modules from a company like ours or someplace else, but have training ready to go as part of the onboarding process on day one. Not only is this a requirement, but it reduces liability for your business, because to not do so, you're really putting your business at risk. The other thing I want to mention too is, so far we're talking mostly about OSHA. Remember that OSHA is really only concerned with the safety of employees. OSHA cares about employees. They're our advocate if we're an assistant, a doctor, a hygienist, a front desk. OSHA doesn't really care about patients. Patients, that becomes more of a function of CDC. Someone asked here, what's the timeline on getting that baseline TB testing? Again, it should be done initially. So, really, as soon as you start that job, right away, one of the first things you should do upon hiring. In the same way, someone asked a question about the timeline for OSHA HIPAA training. Again, as part of the onboarding process. That's why I think it's great when offices attend, say, something like this. We do a number of annual training webinars at Compliance Training Partners, but we still advise that people have a package of online trainings, something where that employee can get trained. They can then get third-party verification that that training has taken place, and they have a certificate of training right as they begin their job. Now, here's a good question from Krista. Should the front office also have a TB test? Yes, and I'll tell you why, Krista. When you think about it, even if you know how it is, a lot of smaller offices, or a lot of offices, period, even if somebody works at the front desk, if somebody's missing one day, you might be called on to sneak to the back, scrub some instruments, maybe do a little assisting. But even more than that, think about it. If there's a sick patient that comes in, the front desk people may be the first one to see them. So I highly advise, even though you're not classically a clinical employee, if you're working at the front desk, I would get that baseline TB test for sure. Now, training records is again, such an important thing. And that's why I really like third-party verification, something where somebody takes a post-test, they have a certificate that shows that they've taken this training, because a training record needs to show the dates, a summary of the contents, who conducted the training, the name of the trainee. And one thing I should add to this, and I think I will for next year's presentation, is the ability to have questions answered by a knowledgeable, quote, knowledgeable person. So I'm a real fan of training that comes with quality technical support when you have those questions that we're all going to have. And remember, the training records should be maintained for 5 years. Very important to keep these records for 5 years. Proof of training, very important. Here's a good question too. Someone says, so if I'm understanding you correctly, if a person's hired, they already have the hepatitis B vaccine, they need to sign the declination for our office. What they could do, Belinda, is they could either, one, sign the declination saying, hey, thanks for offering it to me, Belinda, but I don't want it. Or two, they could give you proof of immunization. So just something from their physician proving that they have been immunized. Either one will suffice. And don't forget too, you need to actually have for every employee a medical record, an employee medical record. So I know we have employee records, the application for employment and I-9 and W-4, but you need to have in a separate file an employee medical record. It needs to be a separate file. Dawn asked here, what if you've been working with the same dentist for 32 years and you had the test before you started for him? If you had the immunization before you started with that doctor, Dawn, again, you should be protected. You don't, according to U.S. Department of Public Health, you don't have to get another one, but you should have on record either proof of that immunization, which you probably don't because it was 32 years ago. It's like me, I had it even a few years beyond that. I don't remember where I got it, but I know I got it. So either sign the declination or have proof of it, even if it was 32 years ago. And again, you're going to hear a lot of things tonight that you might not be doing in your office, but that's the reason for a course like this, right? We're also busy trying to deal with the day-to-day, the insurance companies, the problem patients, that we forget things like this. And that's why we're doing this tonight. Now, here's a good question from someone. If you get a temporary sub-employee from an agency, does that agency have responsibility to show that, that the temporary is TB-free? Well, actually, if they're coming from a temporary agency, that temporary agency is technically the employer, right? So they're the ones who have that responsibility. That might be a good question to ask that agency. Hey, do these people have any OSHA training? Do they have a baseline TB test? I would ask that question because I wouldn't want to see you somehow implicated in some problem, even though you're not the employer. Again, someone asked, how long do you keep records of yearly training? 5 years, Amanda, is how long I'd keep them for sure. 5 years. Let's go on to the next slide. Number 7, failure to provide post-exposure treatment and counseling to exposed employees. Keep in mind that in your written exposure control plan, you know, I'd mentioned there had to be a written hazard communication plan for hazard communication, or for the bloodborne pathogen standard, there needs to be a written what's called exposure control plan. And in it, there actually needs to be a description of your post-exposure evaluation program. In other words, at XYZ Dental Center, if you have a needle stick or a sharps incident, this is what you do and who you contact. So the first thing you do is, of course, talk to whoever's in charge of OSHA in the office, because there is an evaluation and follow-up provided free to the employee after an exposure incident. So let's just say you got that needle stick. Let your supervisor know. Let whoever's in charge of OSHA know. Maybe they're the same person. Wash that area with soap and water if it's skin. If it's a nose or mouth, maybe somehow you didn't have a mask on. Flush that area with water. If your eyes were splashed, that's the time to use that eye wash. Irrigate the eyes for 10 minutes. So now it's time to fill out. And again, you want to have this in your OSHA manual, in your written exposure program, an incident report form. In our system, we have one for the patient to whom you were exposed, one for the employee, and one for the occupational medicine clinic or wherever you're going to send them for testing. And it goes over things like, how did it happen? What date was it? Who were you exposed to? Again, have these things ready to go. I really like to tell people to pull these out of our manual, make copies of the blank pages, the 3 forms. Also have a copy of a map to the local clinic that you're going to send people to. Staple it together. In other words, right in the front of your manual, in the front pocket, have an exposure incident packet ready to go. And people really appreciate that, because think how that can mess up your day if you have an exposure incident and you're not ready to go. And employees really appreciate this, that you're looking out for them, that you have these things all organized, ready to go. You have a relationship with a facility that can treat them. So some of the things that I thought you might be interested to know what they do when they get to that occupational medicine clinic. They're going to do a rapid hepatitis B, C, and HIV test on the employee and on the person to whom they were exposed. They'll offer any post-exposure prophylaxis. Maybe they find out this person, this employee was never immunized, so they'll start the hepatitis B immunization. if the person to whom they were exposed had hepatitis B. Maybe there needs to be some post-exposure counseling, a follow-up, in other words, evaluating illnesses that occur in the future. They may be monitoring them over weeks to months. So again, really implore you, have these things ready to go. So after the employee is gone for this post-exposure testing, that facility that they went to is going to send your office a report. And it's going to talk about basically, we've got it covered. We've evaluated the employee. They've been informed of any medical conditions that require further treatment. So you see, you want to hand the ball off to them. And I even give this same advice when I lecture to medical offices. Even if you're an MD and this is the kind of stuff you treat, if there is an incident in the office, I would have a third party treat and follow that up. So there's not a conflict of interest. You see, a couple of questions. Let me just see if I can, it's actually working out pretty good. Doing a couple questions along the way. It makes it seem more interactive. Amber says, if I'm not mistaken, I know in the state of Georgia, our health department has a record of all immunizations. It shows mine all the way back to when I was born. That is great. I can't tell you if all states have that. That's wonderful. So they're showing all the way back, she says, to when she was born, even 3-month-old immunizations. That's awesome to know. It would be really worth it, right, to check with your state if you're unsure when you had an immunization. I'm not sure if all states have that, but I'm glad to see Georgia does. That's great. Another violation, again, I mentioned not having a written hazard communication plan. The equivalent for bloodborne pathogens is the exposure control plan, not having a written exposure control plan. Basically, this is the written information in the manual on exposure control. It talks about what hazards do you have? What tasks do you do? And these don't have to be super detailed. It could be endodontic procedures, restorative procedures, oral surgery procedures. Which employees are exposed? What PPE do you provide? How is training done in this office? Where do you get the training? So again, you can see why I'm saying either write a written plan or buy a written plan and fill it out, but have one, because it's just one of the areas that we consistently see people have trouble. Some other things that need to be in there are the standard precautions you use, the engineering and work practice controls you use. What kind of housekeeping do you do? Again, how do people get the hepatitis B vaccine in this facility? What type of procedures do we follow, or do follow up an exposure incident? Who do we go to? Who do we talk to? Where's the occupational medicine clinic? So it's not just enough to have word of mouth. This has to be all written down in a written exposure control plan. And a lot of times I'll see in a good office where they're doing all the right things, but they just don't have these written documents, and that's what gets them into trouble. One of the basic tenets of infection control, of course, is standard precautions, treating everybody the same. If it's a known hepatitis patient or your best friend who you don't think has any infectious disease, even though you don't know that, we do everything the same way we clean and disinfect the room, the same way we sterilize the instruments. Everything is done the same, and the standard precautions that you follow should be in part in this plan, in the written form. And of course, engineering controls, these are mechanical things that help eliminate hazards. And one thing that people often miss is that you actually have to have an area in your exposure control plan where once a year you talk about this. Hey, any devices that we could get or anything we could do that could make it safer. Maybe a hygienist who used to work in another office said, hey, I know we use a one-handed scoop technique here for recapping, but I worked in an office that they had this really cool needle recapper. And they had this scalpel blade remover. And everybody might say, well, yeah, let's give that a try. Or people might say, we've never had a needle stick or a cut. It's working really well. But you need to discuss it. It can just be a couple sentences or a paragraph, but it needs to be mentioned in your exposure control plan that you're talking about safer devices each year as a team. With a housekeeping schedule, again, you probably have a housekeeping schedule, but maybe it's not written down. You actually need to have something like this, something that's in your manual and posted on the wall that talks about what do you do between patients, or once a day or once a week. What product do you use to clean it or disinfect it? It gets everybody on the same page. So you want to have a written housekeeping schedule. Let's see here, a couple other questions. Oh, this is really interesting. Someone says here that they temped in the state of Texas before they began employment with the staffing service I was with. I had to provide immunization records. That's really good, Caitlin. I think that a good staffing service would have that. If I owned a dental staffing service, I would want to make sure that the employees did have proper immunization. I'd want to make sure that they had OSHA infection control training. I think that's really important. And I think that's one question you should ask of a staffing agency, right? Because if you get somebody in your office that hasn't had any of that, even though they're not your employee, and they have a problem in the office, guess who they're going to look to? Probably you. Probably their employer too, but also you. So ask those questions of the temporary agencies you work with. Someone says here, another good question from Lean. From my experience, what risks do companies face if they don't have a written exposure control plan in place, both in terms of safety and OSHA compliance? The risks that I find, first of all, if there is an inspection, it leaves you really vulnerable. And when they see that you don't have a couple of the basics, and to me, the basics are training, written exposure control plan, written hazard communication plan, that starts to open Pandora's box. All of a sudden, they're like, what else is going on here? So I think it really leaves you vulnerable. You really want to have these written plans. Let's face it, if we have an inspection, we want them to right away see we're a good office and move on. Lorene asks, do we need to create all these forms? Are there forms available to copy? You know, Lorene, you can create these forms. Forms like this are part of an OSHA compliance system or manual from a company like ours, like Compliance Training Partners. So it all depends how much time you have to put into it. Good question here from Gary. What responsibility do doctors have for cleaning services that maintain their suites that are provided by their landlords? Now, it's interesting. In our practice, we always had our own cleaning crew. It was actually a husband and wife, and we actually let them sit in on the OSHA training every year. We wanted them to know how to protect themselves. Now, if you have somebody who's provided by the landlords, what I would do is first of all, you might say the landlord's really responsible, yet at the same time, they're going to say, look, doctor, you're the healthcare professional. You need to provide some protection to these people. I know technically they're not your employee. What would I do? I would make sure that you have a quick walkthrough with them so that they understand the difference. What does a biohazard symbol mean? Why is it I shouldn't reach into this sharps container? Why is it that these waste baskets in the operatory, even though they aren't labeled biohazard, I want them to know that there's still gauze with some blood put in there, that there's still cotton rolls with saliva on, that you just don't go reaching in there without gloves on. I would just, out of decency, but also to protect your business, I would provide a little training to them. Obviously, it's not going to be the 2-3 hour annual OSHA training unless you want them to sit in on it. I would give them a basic tour and safety briefing. I guess I would call it a safety briefing to protect everybody, including your business. In the exposure control plan also, that's where you want to have your policy on regulated waste. And everybody needs to understand non-regulated waste. This is the stuff that, we just put in the operatory trash can. Where regulated waste, on the other hand, this has specific disposal requirements. For example, things like sharps. So sharps, another area I find a problem is when people don't have sharps containers in every room, or they don't have proper sharps containers. Now, if you're buying a sharps container from any distributor, believe me, it's closable, it's puncture resistant, it's leak proof, it's labeled or color coded. Just don't go trying to make your own sharps containers. I see it all the time where people have painted a can or a bottle red and put stuff in it. Don't do that. If you're purchasing a sharps container, you don't have any problem. The only thing that you do have to control is, do you have one in every room? In other words, is it close to where the sharps are generated? I've seen too many violations for an office just having a central sharps container in the back, okay? And everybody's carrying things through the office to dispose of them back in the lab. Make sure you have one of these quart or half-gallon sized in each room. Also, let the team know when these things get about 7/8 full, cover them up, cap them up, put in a new one. I've seen too many needle sticks from people trying to jam that last needle in there. It's just not worth it, because to me, that's the worst kind of needle stick. At least if you got exposed to Mrs. Smith in room 3, you got stuck with a needle that was used on Mrs. Smith in room 3. If it's in a sharps container, you don't know who you were exposed to. Now, the employer, of course, provides the PPE, but it's also incumbent on us to make sure that employees are wearing it. They've got to wear it. It needs to be available in the right sizes. It needs to be cleaned and maintained by us. In other words, you can't take home your lab coat or your long sleeve scrubs to launder at home. It needs to be either washed in the office or picked up at the office by a laundering service. You could use disposable, but I don't think that's real practical. And someone asked a good question here about laundry. What are my suggestions on laundry? What I've always done, I've always left scrub pants and long sleeve scrubs in the office to be laundered in the office. We had a washing machine right there. If you you wanted to wear short sleeve scrubs to and from your house every day, launder them at home, you could do that if you had a long sleeve, knee-length lab coat that you wear over them every day and leave that in the office to be laundered. So you've got to be leaving some protective garment in the office to be laundered. So I want to talk about also some other areas cited by OSHA. I of course, spent most of the time on bloodborne pathogens and hazard communication, so chemical safety and safety with bloodborne pathogens. But we see a number of times, although those may start that inspection process, we've got to remember that the inspectors are trained in these areas. They're always looking at these things, whether it's ionizing radiation or first aid or non-ionizing radiation or ventilation, egress, signage. So I just want you to understand that we need to look at these things too. It's just really, really important that we do. Someone asked a question here about non-ionizing. Let me just mention, just briefly, because this is a 50,000 foot view course right tonight. This is an annual OSHA training, just to go over where you could be vulnerable, where we see people get into trouble. Egress, we will see people who have a problem, a violation because they don't have proper exit signage. Non-ionizing radiation. Non-ionizing radiation would be, say, laser. A laser is non-ionizing. A curing light is non-ionizing, not providing eye protection for those devices. PPE, of course, we all know about that. Mask, gloves, glasses. Fire safety. A lot of people don't realize that OSHA inspector is going to look for a fire extinguisher and make sure that it's being inspected once a month. And by the way, don't fret that we can't go into detail on all this tonight. I'm going to give you a QR code to download an audit app so you can go in and audit your own office and see where you're in compliance and where you're not. Now, first of all, my kind of take on OSHA inspection is going to surprise you. I believe that I and my company have been involved with more OSHA inspections in dentistry, and probably also, I know in veterinary medicine also, and also in office-based medical offices, but in dentistry, than anybody in the US. And the reason is because we work with all the major distributors, and whenever they have a client who does get inspected by OSHA, or they have a problem, we usually get, we are referred to them. But we've been involved with a lot of inspections, and what might surprise you is the OSHA inspectors are actually pretty fair. They're actually pretty reasonable. I've seen very few cases of them really being out to get you. Sometimes I almost feel like they're rooting for you to come in and hopefully you've got a safety program. Because I don't see a big mystery. I don't see them trying to look and nitpick and trying to make life miserable for us. Instead, I see them coming in and saying, okay, we need to see your OSHA manual with the written documents in it. That written has a communication plan. That safety data sheet binder, or the data sheets on a hard drive in your office. That written exposure control plan. Also your training records. So right away, imagine you're the inspector. This office has all these things. Pretty impressive. They got training records for everybody. They're going back several years. We've got safety data sheets. We've got an OSHA manual that's got these written plans in. Okay, so they can check those boxes. Next, they're going to look for some of the posted documents that are required, like I'd mentioned the housekeeping schedule, but there's also the OSHA poster. There's called the OSHA, Your Rights Under OSHA, that big yellow federal poster. That needs to be up. So they walk around and look for the basic required documents. They'll interview employees, and you might think that's where it really gets difficult. But actually, they're usually pretty fair with this. In fact, all they're trying to do is see, do employees actually know where things are? It's like, okay, you're a hygienist in this office. Do you have any idea where your OSHA manual is? If you needed a safety data sheet for this fluoride that you're applying, where would you get it? So they just are asking, I'm going to call it 20,000-foot view questions, not super detailed. They want to make sure that employees have been trained, understand where's the manual, where's the iWatch, where's the safety data sheet. And then they walk around, they take a few notes. They don't typically say a lot. And what you'll find then is sometimes several weeks to several months later, you could get a citation. But always remember, an OSHA inspector could make a mistake. We've several times over the years dealt with maybe a young inspector who hadn't had the experience. Maybe they made a mistake. I mean, one example that comes to mind, an inspector that once cited someone because they didn't have cassettes. Cassettes are a great idea. I love cassettes, but this inspector didn't understand that cassettes are a great engineering control, but they're not required. We helped them write the letter of response, the citation, the fine was gone right away. So if you somehow run into a problem, contact us. We go through it in a lot of letters, help people through these things. They really are not that bad. I really mean that. If you're doing the basic things we're talking about here tonight, you're not going to have a problem and you'll be able to sleep easily. Also, CDC guidelines will see that OSHA can actually enforce CDC guidelines. A lot of times people think, well, it's CDC. I'm not worried about it. They don't have inspectors. They're just guidelines, where OSHA is a law. But don't forget, OSHA can enforce CDC guidelines under its general duty clause. The general duty clause basically states you need to provide a safe and healthy working environment, and you just need to use common sense safety. Also, don't forget, your state dental board can enforce these things. Your public health department can enforce them. The public in courts of law, if you ever had the bad luck to end up in court. CDC guidelines are the gold standard, if you will. They're best practices. They're the gold standard throughout the world, and they're what people expect us to be doing. So I mentioned here an audit. To me, I think it's like taking off in an airplane, right? You can't just wing it. I would go through an audit checklist. I would go through that checklist once a year. I'm going to give you a QR code for one here, and I hope you'll find it helpful. I'd say once a year, it's going to take about an hour. And believe me, you're going to find some things that you're not doing, but that's the reason we're doing this. And that's why I appreciate everybody attending this tonight, because you realize you want to get better. You want to make it safer. If you want to scan this QR, and again, as a follow-up, we'll send it to you as well. It will give you the opportunity to do an OSHA, an infection control audit, see what level of compliance you're at, and then start to go after the things that you've checked no to. And you're going to have them. It's just the way it is. We'd have them even in my office. If we do it once a year, sometimes you forget things. Things are missing. That new employee didn't get trained. That new product you got, nobody's obtained that safety data sheet for it yet. So try to move ahead on this. I think you'll find it's not that difficult. I really believe that. So again, as part of attending this webinar, you certainly have access to us at Compliance Training Partners. We're glad to answer questions you have. We do have a team of OSHA authorized trainers who can answer questions. If we don't have an answer, we'll certainly find it for you. That's what we do. And I want to, as this slide is up, I just want to thank everybody for attending. And I know there's still some questions which I would be glad to answer. Let me just click on this for a minute and see if I can't answer a few of them here. Let's see here. Here we go. Is it a legal matter that PPE scrubs be washed on site? Also, what PPE are we required to provide? Well, you're required to provide, masks, gloves, glasses, etc. When it comes to clothing, again, your choices would be wash it on site. We always had a washing machine right on site, and we actually the people who cleaned our office, we hired them to come in a little early every day and run the uniforms. You could also have a cleaning service pick them up. But the fact is your PPE, something needs to stay in the office and be washed, whether it's your long sleeve scrubs and pants, or at a minimum, if you want to wear those home, you need to have a lab coat in the office that you have washed, something that covers up that clothing. Somebody says, should we dispose of hygiene instruments in the sharps container? Yes. If you have broken, used, unusable instruments, say you got your Columbia 1314 or your Jaquette scalers, it's no good anymore. Yes, dispose of it in the sharps container. That will be just fine. Do fire extinguishers require monthly inspection in all states? Yes. Yes. And again, 30-second inspection. You go up to it. Is it expired? No. Is it leaking? No. That's really all you have to do, is see that it's up to pressure, it's not expired, it's not leaking. Someone asked here, should I document and put in a binder if a doctor doesn't want to follow OSHA standards? She won't allow yearly updates. She has no lab coat. She has polished nails, no soap by the sink for hand washing. Melanie, what I think I would do is I always like to try to take the high road in this. Maybe download this app and show it to her and say, look, doctor, I just like to make the office safer for everybody, and I'd like to protect your business at the same time. And say, look, I'd be glad to take on some of these responsibilities and help you with it. I guess I try to take the high road, and maybe by giving her an app that could make it easy, that might help. Is OSHA required in Colorado? Yes, it is. As a matter of fact, it's required in all 50 states. In fact, I've even been involved in OSHA inspections in U.S. territories like Puerto Rico, U.S. Virgin Islands. Here's a great question. I believe we have numerous MSDS sheets. Yes, those are obsolete. You're correct. I will tell you that all the products you buy now do have SDS sheets available. What I would do is just go to that company's website and you'll be able to download that safety data sheet. I guarantee you they're available now. Someone asked here, cost of third-party OSHA training. You can do is, again, when you just go to the compliancetrainingpartners.com website, and you can see different training options there for, online training and computerized training. So just go in there. Someone had logged in just a little bit late. What was violation number 1? That was just not having a written hazard communication plan was what that was. And actually, I think what we're going to do is we're about almost out of time. Trung, I believe you're going to take it from here and put up the CE code. Am I correct?
No CE code.
Oh, no CE code needed. But the only reason I asked, someone had asked the CE code, please. Could you just describe what they need to do to get CE?
Sure, you can take the exam afterwards, and no CE code required for that.
Okay, you made it easy. Okay, great. In that case, I've still got a couple questions I'll answer here. If you had a positive TB test and treatment, can you still get TB? Here's what's interesting. If you have a positive TB test, that means either you may be infectious or you may not. You have to see if you have a latent TB or actually TB disease. So you get a positive tuberculin skin test. The next step is going to your physician, infectious disease expert, chest x-ray, sputum analysis to see what type of TB you have. But if you have a positive TB test, I guess I wouldn't be worried about can you still get TB? You do have TB. You just have to find out what kind of TB you have and if you're infectious. What should the employer do if they have not had the employees do TB tests at onboarding? I think what I would say is, look, I've learned that this is something we should be doing, so I'd like to do it for all of you. We've got you an account signed up at XYZ Occupational Medicine Clinic, and just get it done. Just get it done. It's not expensive. Someone says here, if we offer the laundry on-site or option of lab coat over top, an employee prefers to wear no lab coat and wash at home, do we have to say that's not allowed? Yes, you'd actually have to say that that's illegal. You can get all of us into trouble, including yourself. You've been very nice there. You've given them an option. Look, you can wear a lab coat that will wash, or you can wear scrubs that will wash, but you've got to do one or the other. And I would make sure everybody put right in your employee policy manual, failure to follow OSHA, HIPAA, and infection control violations may be grounds for dismissal. We need to take this stuff seriously, not just to protect them, but to protect our business. If your office uses disposable gowns, does the same uniform laundry policy apply? No, if they're disposable gowns, just simply throw them away at the end of the day and go home. They could wear their clothes back and forth to work, wash them at home as long as they're covering them with a disposable gown. Here's a question. We had an OSHA trainer state the fire extinguisher needed to be flipped each month. Is that necessary as the inspection of the fire extinguisher? I don't know where on earth they got that from. Flipping the fire extinguisher, trust me, you don't need to do that. All you need to do is make sure that fire extinguisher is not expired, not leaking, and up to pressure. In other words, it's in that green zone. I'm glad this question was asked. We put extracted teeth in a sharps container, even if it has amalgam in it. Is this okay? Christy, you don't want to do that because a lot of people do, but it's mixing categories of waste. Sharps are sharps where teeth would be considered biologic waste. You would do better to actually, I would really, if I were you, not put teeth in there anymore because you're mixing categories of waste. I would instead use an EPA-approved tooth disposal container that you can do a mail back on. Not that expensive. You mail them back a couple times a year. But you don't want to put them in a sharps container. So if OSHA is about protecting employees, what about patients? I left an office that didn't have surgical instruments wrapped, didn't run burr blocks, didn't do testing, blah, blah, blah. Tammy, absolutely. The problem there is OSHA is only concerned with you, the employee, but CDC, Centers for Disease Control, and the Department of Public Health, they're the ones who would not be happy with the things you're talking about there. Those things all are part of the CDC guidelines. If they're not following them, the practice is really at risk from Public Health Department based on them enforcing CDC guidelines. Would employee perfumes and or colognes be considered as violations? They would if you put a policy. I would have a written policy. There's nothing in OSHA or CDC says that you can't do it. But if you don't want them to wear that, I would make it part of your written policy, because let's face it, that can be offensive to some patients. How can I approach my young 19-year-old DA to take care of their hair without insulting them? I think the best way to do it is tell them that you care about them. Look, the reason these OSHA laws are there is to protect you. I mean, you're young, you're only 19 years old. I mean, these things can cause harm to you over time. I guess I'd take the high road and try to encourage them that you're there to try to make their life better and make them safer. Someone says, maintain an SDS for 30 years if the chemical is no longer made. Yes, just keep them for 30 years, throw them up in the garage somewhere, but keep them. It's actually a 30-year requirement, which is amazing, right? We only have to keep patient records 10 years after we stop treating them, but we have to keep these much longer. What are the required vaccines to work, required to work in a dental office? What you can do is at compliancetrainingpartners.com, you'll actually see on our Learning Center immunizations recommended for healthcare workers. And you'll find, the usual COVID, Tdap, tetanus, diphtheria, pertussis, annual flu exam or flu vaccine. You'll see those all listed there. Do clinic shoes need to stay on premises? It's not required, but I think it's best practices. I always wore a cheap pair of tennis shoes and left them at the office. I just didn't like to bring them into my home, but it's not required. Do the lab coats need to be washed daily or new disposable daily? It would be either washed daily or a new disposable daily, whichever your choice. And again, we've got, someone says here, and this will be the last question I'll take. I've gone a little bit over. I really appreciate everybody's interest. And again, you can call our technical team. We'll be glad to help. But this is the last question. What is the policy for tattoos, long nails, jewelry, open-toe shoes for clinical staff? Is this an office-written policy or an OSHA CDC policy? Really, it's a little bit of both. And again, at our Learning Center, I think you'll be able to find that. But basically, CDC says we shouldn't be using fake nails or long nails because of concerns with infection control. We shouldn't be using jewelry that would, quote, affect the fit or integrity of the glove. So if it's tearing a glove, for example, open-toed shoes, not recommended. So I would make that your written policy for your office manual, whatever you'd like them to do, which basically is our policy is to follow OSHA and CDC guidelines for safety and infection control. Well, with that, I really thank everybody for all the time tonight, and I hope we get to see you on a future webinar.